in biodiversity. So I wanted to just stress 2-3 points which I learned. One is, of course, when we are taking, it is very important that we have nutritious food, and it has different vitamins and minerals to support our body and so on. And in that quest of giving people enough vitamins and minerals, what has happened that in vulnerable countries or the public, which is like people, vulnerable people, or the country that is a country that is low income and so on, the products are exported to them with, say, for example, the rice, and they advertise that the rice has certain vitamins like vitamin D, some sort of minerals, and so on. And you can see everywhere, even in your breakfast or cereal and other things like food, whatever you have, it says plus this, plus this, plus this, meaning that you just eat that and you don't need to eat the variety of the different food, or you don't have to take stress of eating vegetables and so on. And that is impacting biodiversity a lot, meaning that it is decreasing the value of the diversity that we are having. It is important that, of course, we should have the nutritious food, but also to look at why, how we have it, and why such products have been, and these products have been advertised a lot. They are taken by big manufacturers, and that is definitely an issue. So that is one thing we need to think around. Secondly, we have to also think that when we explore, when we are moving from the fossil fuel to the biotechnology and the biofuel and so on, it will ask our land to manufacture different products instead of food. And therefore, again, there will be a lot of land stress, a lot of impact on the food production and so on. And within all these, how then the individual farmers will survive? Because when we say that in a mass, rice is grown in a mass by large manufacturer and they give all the multiple vitamins, then who will take the food from the small farmers? And that is an issue again. So here, I think there are several issues. Again, I can put, like a woman issue and young people issue as well, because established people have plenty of opportunities, but the young people who do not have any opportunity, as like they do not have any experience, they do not have any exposure, how they are going to grow in such a competitive world? So it is very important. And again, with women, what happens that most part of the land is owned by men in world. And in many countries, the landowner cannot be a woman also. So that are also, again, issue that we need to look. So going through the whole food sustainability, we have to look at the food value chain. And that is very important to look at different aspects, such as what I mentioned. And we must bring multidisciplinary, which you have already done, and talk about it, discuss about it. Again, with your program, what I would like to say, please develop your position paper. When you are speaking, we are doing several events around the world. I'm also doing, and we are all others are doing. But we lose our knowledge just by disseminating on videos, because videos are not reached to everyone. So have a position paper, put in different medias, on social media, on hard media, everywhere. And that is also very important, that we put our knowledge back to the community in different ways so that everyone can understand, absorb, and so on. is what we want to do in all countries. And that will be a grassroots movement, which would be an exponentially successful with what we want to decrease inequality and offer opportunities to everyone, leaving no one behind. And the very last announcement for my personal, which I am getting on 26th of October, Humanitarian Global Award. Thank you very much.
Please let us use our reaction to show love to what the last award mentioned, proclamation, nomination, and an honor that Dr. Anoka mentioned. Yes, well deserved, well deserved, well deserved, well deserved, well deserved. Thank you so much. I was actually looking forward to that very announcement about the Green Award, because I look at the pages of what the Green Awards was like, and what it's aimed to achieve. And I was like, yeah, this is very wonderful initiative. This is a very good project. And I was like, thank you so much. Yes, this month we are going to look at Earth Sustainability Triangle, where we'll be talking about the human and also the microbes and the environment. This issue was actually what we wanted to focus on last month of September, before we had the incoming, the coming in of Dr. Chef Montasir about food sustainability. And because of the schedule of the training, so we try to adopt that for the month. And because we're still trying to perfect the logistic about this very session, so that was why we postpone it to this month. So this month we'll be talking around health issues. And I believe that Chef Zaneb Hassan is going to be very active to look at the perspective of the health issue, because we have some aspect of it that is affecting what we want to discuss from the food perspective. We have an aspect of it that is coming from the food perspective. And also Chef Ina is going to be very active in contributing to this. And at the end of the day, what we do is that whenever we pick a topic like this, we develop a project around it. And when we develop a project around it, we make it a proposal and submit it for grants. And we are getting to the stage that some of our grants that we have applied for are reaching the final stage of assessment. If they are approved, then we got to the level of the team around this are going to implement it in their different communities, in their different countries. And that is part of what Dr. Renoka was saying. We don't talk about the issues alone. We talk about it, we develop solution, we make it into proposal, and we submit it for grants. Because we have so many funders that are awaiting the solutions to what they can put their money for people to implement. And that is what we are focusing on. So, and that's the reason why our principle is sustainability beyond words. We don't talk about it alone. We take action around it so that we can make impact with what we have discussed. So on this very note, we want to start the program today. And our facilitator today are health expertise from the federal government, from Nigerian federal government medical department. They have been in this very profession for quite a long time, if I'm not mistaken, for more than 10 years, because as a student at the technical level, as a student at the degree level, as a technical apprentice in different hospitals, different large hospitals, and as a consultant in the field of microbial inventions and laboratory examination. So they have put up this very concept together, and they are going to present it to us. But before they start, I would like to welcome our session chair, that is Professor Femi Ajayi, who has just joined us now to actually make an opening remark about this very session that we call Health Sustainability Triangle, Human, Microbes, and Environment. Professor Femi Ajayi, sir.
Yeah, thank you so very much. members online. Let me start by welcoming every one of us. And let me also congratulate our GSLSN for all this feat. There is something that gladdens my heart, that since we have started, we have never been offline, especially when we should be, despite the technical challenges that people may face from wherever other parts of the world. Let me congratulate Dr. Sahid Adebisi, who has been working around the clock to ensure that we do not miss any beat of our activities. And I congratulate every one of us for the stage to which some of our grant proposal requests has gotten to. It gladdens my heart. You know, I mean, my gadget is on 24/7. The moment any news comes in, I'm always excited to read about the progress we are making. And let me say that we still have many more grounds to cover. The program today is such that everybody should be eager to be part of. And you see, this triangle that has been proposed as a kind of interaction, a kind of tripod stand, which is going to leverage everybody as per the environment, the food, and the microbial world. Let me say quickly that this triangle of a thing has come to project to us what sustainability will actually present to us. And as we go into today's activity, I want to assure you that we have a lot to learn and we have a lot to benefit from. I congratulate our facilitators, as those that are going to facilitate. They are highly experienced people who have been trained and highly professional. And as many as missed the training that we had from our guest trainer, the chef, can they remind me his name?
Chef Muntasir.
Is it Monsa?
Muntasir.
Montasir, Chef Montasir. It was very interesting. When people saw my badge on LinkedIn, some people called me and say, Oga, some of my students of the past, Oga, are you now a chef? I said, yes, proudly one. I'm promoting sustainability even in the kitchen. Some of them, they were just congratulating me and all the likes. I mean, that very tiny thing that somebody did, that we do not know that we earn all such accolades. I sincerely want to assure you that what we are going through in this part, this period, is something that we earn us a lot of accolade too. I want to congratulate us and wish us a very wonderful deliberation as we go into the activities of the day. Thank you very much, and you are powerfully welcome.
Thank you so much, sir. And yes, let us go straight into the presentation. Why I recognize the presence of Mr. Michael Wanjusi from Uganda and also Dr. Ebenezer Ajayi from Nigeria, or let me say West Africa. Thank you so much for joining. Yes, Latifat, so let us go to the presentation.
Okay. Good morning, sir. Dr. Adebisi Said, and our global chair, Dr. Mrs. Renuka, and our sustainability chair, Professor Ajayi. Good morning, everyone. The
Good morning,
presentation is all about the health sustainability triangle from the angle of human, microbes, and environment. The health sustainability triangle offers a holistic approach to understanding the complex relationships between humans, environment, and microbes, guiding efforts towards sustainable health outcome. What do I mean by this? looking at the environment is our habitat that we trail and we live comfortably when all the ecosystem is balanced. The environment gives us clean air that we breathe, water that we drink and use for all our activities, food materials, that is our agricultural produce, the one that we eat as fruit freshly prepared, and the one that we have to process to finishing products before we can take them. And environment also give us a space to recreate, reproduce, and recreate ourselves. Then talking about the microbes, their own contribution to an healthy environment cannot be overemphasized. They are the major drivers of elemental cycle, such as carbon cycle, nitrogen cycle, and phosphorus. And they are the important producers and consumers of greenhouse gases and pertinent pathogens of human and animals. Then, having said this, let's move to make a balanced ecosystem as to social well-being and health well-being. Then, looking at it from this angle, sir, human activities impact environmental health. As I said, when we have environmental balance, the ecosystem balance in the environment, we have the positive effect, which I just mentioned, that we breathe in clean air, we use clean water, and our carbon cycle and nitrogen cycle is also complete and is being monitored by our microbes, which also affects our agricultural produce while we plant on farm. But when the other way around happen, when our activities like urbanization, industrialization, and agriculture activities, we tend to alter the ecosystem balance, in which we now have the negative effects like pollution. Our industrial effluent released to the environment causes pollution like land pollution, air pollution, water pollution, and it also contributes to greenhouse effects. It also affects our climate change. Our activity also affects it in a negative way through pollution that I just mentioned. Example is our greenhouse effect that we all know, we are all aware of it now, due to our burning of fossil fuel and carbon footprints with all our activities. Then deforestation. When we want to build our industry or our educational center, our houses, we try to fell trees to have space to create more convenience and comfortable zone for ourselves. But due to this activity, we have altered the ecosystem and it's affecting us. It's also affecting our social well-being. All the clean air, clean water is also disrupted by deforestation. Talking about the environmental roles, yes, I've already explained this in the previous slide. When the air quality is affected, is altered, it also causes that we breathe in the unclean air, causes respiratory issue. Then water quality also altered, causes waterborne diseases like the flooding, when the effluent is reduced to the water body and find their way into the homes, and we, one way or the other, we ingested it and it causes waterborne diseases like cholera, typhoid fever, and the likes, food poisoning. Then temperature. Our temperature, we have the temperature according to weather changes. When the temperature is high, it's not too comfortable for us. It causes heat stress and hypothermia. Then this temperature also affects the microbes. There are some thermophilic organisms that thrive well when the temperature is higher than 37 degrees C. And these microbes also causes infection. So they thrive more when high temperature. And some also affected by the cold temperature, they also thrive well. We have some organisms like that. When there is natural disaster through our activities, like flooding, like earthquake, like hurricane, they also causes the mental health, then physical harm. When people don't have that freedom to access the standard health facilities during disaster, it's hard to reach the health facilities for treatment of infections. Microorganisms, we have them in our body as normal flora. They hate, we have some that hate digestion, we have some that protect our skin, we have some that line the respiratory tract as a mutual and symbiosis. They have mutual and symbiosis effect on us when they have not been altered. But by the time we have the alteration of the microbial load or microbial population, they disrupt the host sites and causes infection. Then what is antimicrobial resistance? Antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites, they are no longer respond to antimicrobial medication. And as a result of this drug resistance, the infection are more difficult and impossible to treat, increasing the risk of disease spread, severe illness, and disability. It might also cause death. Types of antimicrobial resistance we have vancomycin resistant enterococcus, multi-drug resistant Mycobacterium tuberculosis, carbapenemase producing enterobacteriaceae, methicillin resistant Staphylococcus aureus. Then what are the causes, related factors that causes the antimicrobial resistance? We have human-related factors, healthcare-related factors, environmental factors, microbial factors, and socio-economic factors. How does human causes the antimicrobial? By overuse and misuse of antimicrobial, by self-medication, inadequate dosing, and duration of treatment. When we don't comply with the dosage regimen prescribed by clinician when we have infection for the treatment, either we don't complete the dosage, or we see maybe when we have another infection, instead of us to go back and complain at the hospital for proper prescription again, we just use the one that we have at home without consulting any clinician, without even any laboratory diagnosis or test being done to know the appropriate antibiotics that will treat that infection being experienced by individual. This also causes the antimicrobial resistance. Then we have poor infection control practices. That is when we don't know, we are unable to control the spread of infection, like especially the communicable disease like cholera, like COVID-19, for example. They are communicable disease. The health professionals, they advise that if somebody has been infected by COVID-19, they should isolate themselves. That is, they should not be among the population again until they are okay and well treated. But when we break this rule, it's easier for such communicable disease to spread among the population. Then the healthcare related factors include the following: overprescription of antimicrobial when there is overdosage, insufficient antimicrobial stewardship, that is when there is no enough antimicrobial agents to dispense to people that need it, and as a result we have underdosage. And underdosage is deadly. It's like we call it when we kill a snake and we don't kill it completely. they said that the remaining part that when it generates is more harmful. So it also contributes to antimicrobial resistance. The inadequate hospital hygiene and sterilization. This one can happen when the staff or the professionals are not trained. They are not well trained or aware of what they should do, because there are some equipment that when they are not, they cannot be sterilized by dry heat. They are better be sterilized by autoclave, that is steam, moist heat, like steaming, or supersaturated steaming. At that very degree, such microbes will not be totally eradicated by dry heat, but they can be only eradicated using that supersaturated steam by autoclaving. Then when people, or especially the patient's relative, when they visit hospital to go and greet their relative that are hospitalized, they don't usually take caution. They don't take caution when they enter the hospital environment. They're supposed to clean their hand immediately after. They're supposed not to even touch any surface when they enter the hospital. Even as a patient coming to the hospital environment, you don't just touch any surfaces, and you make sure that you wash your hand before touching your body after visiting an health facility. And when you are even with the patient on admission, when maybe they have tests to run, they collected the sample of such a person, the relative is supposed to use their hand gloves, but at times they use their bare hand, delivering such samples to appropriate laboratory. They're supposed to take caution. If that caution is not taken, this is how the resistance gene they spread among the healthy population. The environmental factor include antimicrobial use in agricultural and livestock. I talked about this the other time, that a veterinary doctor spoke with me and mentioned that when they visited the abattoir, they saw the man that is applying the antibiotics, that giving the ram the antibiotics due to lesion he just saw on the animal. And they asked, why do you think this can resolve this? He said that is how they use to treat the animals. And these are the products, the dairy products that we use to take in our everyday meals. So when the indiscriminate use of antimicrobial agents is on the high side during the processing of our food, they also serve as a means through which the antimicrobial agents resistance spread among the healthy people. Contamination of water and soil, as I've explained before, these microbes, they have the ability to form a biofilm on our pipe, which the water pipe way, and they can easily get their way into our home water home usage, transferring the organism into our body system. Then poor waste management. Yes, poor waste. I've given the example. I still refer to we have so many type of waste. So inappropriate waste management also serve as a means through which these antimicrobial gene, they are being transferred horizontally among the microbes, and also find one way or the other, whether directly or indirectly, find their way into our body system, adding to the populace and the spread of antimicrobial agents. When we visit the sick people in the hospital, please let us adhere to the hand hygiene. Microbial factor. Yes, we have genetic mutation and adaptation. these microbes, they have the ability to mutate over times and try to adapt to the host environment, hostile environment in the host. They also mutate to equip themselves to resist the antibiotics being taken by the sick person. Then we have horizontal gene transfer. When they form the biofilm, they have the ability to transfer the genetic material within themselves. And if the resistance gene can also be transferred through this horizontal gene transfer, the biofilm and the virulence factor like endotoxin, exotoxins, capsule, and spore, they have the ability to develop all these in order to be resistant to the antimicrobial agents. We have this socio-economic factor as poverty and lack of access to health care. When there is no money, people cannot access the good health facility to properly treat the infection or disease that they are experiencing. Then limited education and awareness. When people don't have full knowledge of how and when to take antimicrobial agents and what type of antimicrobial agent is effective on their ailment. For example, somebody that has bacterial infection cannot use anti-malaria and this infection will go. No, but we don't care to even know what is wrong with us. Whenever we feel uneasy or when we feel weak or we are experiencing any pain, the next thing is go to nearest chemist, get antibiotics. It might even give a malaria that you just need to take anti-malaria. It might even be stress. People don't know. They just take these antimicrobial agents indiscriminately. So this also contributes to the antimicrobial resistance. Weak healthcare system, especially in the hard to reach environment, like a place where they are experiencing flooding, earthquake, and all the likes. There is no standard health facility there because the professionals are also scared of going to such an area. This limited the people around such a community to access the healthcare system, and even they lack awareness as to when and what to use to treat their ailments. Then conflict and displacement, I've already said, like flooding that is happening in Maiduguri, taking for example now, people are displaced. They don't have access to their comfort social amenities during the flood, which is a natural disaster. Then we have the global factor. The global factors that affect this is international trade and travel. When people move from one place to another, one country to another, maybe like during the COVID-19, there's a restriction of people traveling abroad for either in immigration or emigration. Is being properly checked to see that the infection is not transferred and from one place to another. That's why there's a restriction of movement to control the spread of infection. Then what are the consequences of antimicrobial resistance? This includes increased morbidity and mortality. There is increased morbidity and mortality in the sense that when there is illness and ailment and there is no proper, this is difficult to treat such an ailment with the available antimicrobial agents due to resistance gene that has been spread and the population. This illness will continue to affect the patient and it takes long time of treatment too. It's prolonged illness and recovery times. Yes, it's also prolonged illness and recovery times. Increased healthcare costs, of course, when there is more antibiotics to use and they are resisting and the infection is not going, they also prescribe more antibiotics until the cost, there is no cost effectiveness in the taking care of such an illness again, because you need to repeat and keep repeating the antimicrobial agent in the course of finding solution to your illness or treatment. Then it reduces effectiveness of antimicrobials. Yes, it doesn't make the first line of antibiotics effective again. All the first line of antibiotics are not even effective again. They are not potent enough to treat most of the common infection as before. Even the second line of antibiotics are also scarce. They are very rare now. Most of them are also resistant according to our findings. Then it reduces manpower. Of course, somebody that is ill and cannot be socially active again. They cannot be socially active again. They cannot even add to any productivity in the community. Then threat to modern medicine. Antimicrobial resistance is threatening the modern medicine in the sense that the common procedure for some ailments like organ transplant, chemotherapy, even cesarean section can become complicated through the antimicrobial resistance. Then what are the solutions? Antimicrobial stewardship is first one that people should be aware of when and how to use antimicrobial agents. Self-medication must be prevented. Self-medication must be prevented. Improve infection control practice. I've said it before that we should always have the conscious of our environment, especially when we visit the healthcare facility. We should imbibe the culture of proper hand washing, regular hand washing whenever we are there, whether we go for our own health issue, maybe it's visited for screening, testing, and the like. We should even have the clothes properly and wash properly, sun dry before we even hang them in our wardrobe. Then we should also always use hand gloves whenever we want to dispense our patients or relatives that are hospitalized. Whenever they ask us to go and deliver such specimen, we should use our hand glove, not bare hand. And we should be aware of we should be careful of how we touch the surfaces. Then enhance surface and surveillance monitoring. There should be a proper surveillance and monitoring of antimicrobial agents to know how to draw a policy to curtail the spread. Then development of new antimicrobial. There should be an alternative to all the existing antimicrobial agents. Yes, there should be. Then vaccination and prevention strategy. This is more safer and cheaper. Like when we compare it to the effects and significance of the antimicrobial resistance, this is more safer and cheaper. If we have vaccine, we are all vaccinated against all the infection, and there is prevention strategies through which there is low spread of antimicrobial agents. It will be more easier and more cheaper to treat any infection in any treatment, and there will be a minimal rate at which the antimicrobial resistance gene will be spread among the population. Then public awareness and education campaign. This is also very, very important to let people know that if they have malaria, it's anti-malaria that can cure the malaria. If they have food poisoning, it's a self-limiting. Not always that the cause of food poisoning is caused by the bacterial infection. It might be self-limiting. And when they just take ORS to replace the lost fluid and rest, and they should be able to be okay. Not that we should use tetracycline at the advent of all the maybe stooling. We're supposed to look at it like, okay, what is the causative agent of this? What causes this maybe my running stomach or stooling, before we take the tetracycline or all the likes of antibiotics. If you have parasitic infection, it's only parasitic agents that can take care of such, not antibiotics. And if you have bacterial infection, it's only antibacteria that can cure it, not the antiviral agent. People should be aware of what is for what infection, what agent is for what infection. Then, all in conclusion, we should all know that antibiotics doesn't work for everything. We should be aware of what to take as per the infection we are experiencing. Thank you all.
Wow. Please let us show appreciation for this very presentation. Let us use our reaction to show appreciation, please. Please let us show appreciation. You know, there is something that is peculiar about this very presentation, and that is the beauty of the GSLSN. We have different professionals, we have different experts from different fields, and that is the beauty. When I was approached about this very session that let's have a session for the health sustainability, I was like, what is the issue about the health? And they started telling me different cases in their laboratories. And I was like frightening. And even when I was listening to this very presentation, I was still all through. My face was squeezing that we are in big trouble. Like we are in big trouble. Like we are in big trouble. Okay, which aspect of our life is even safer? We talked about the food last month. A lot of things were refilled. We talk about education. A lot of things were refilled. We talk about climate. A lot of things were refilled. And this thing that Professor Ajayi said, that we need to learn from individual professionals, to actually clearly understand the sustainability we are even trying to even contribute to. And that was the first statement that Dr. Renoka said when he joined this very network, this very session today, that he took a lecture on biodiversity and she understood another dimension to sustainability. Please, on this very note, I will not prolong so much that has been revealed in this very presentation, because it is a whole lot of things that we can keep on talking about till tomorrow. But I will just say, let me just stop here on giving the background of what is very peculiar about this very presentation. It has opened our eyes to another dimension of sustainability. That is the point I am trying to make. It has indeed opened our eye to another dimension of sustainability. I won't talk much about this for now. I would like others to contribute first. Then, Chef Ina, I could see that you were eager to even raise your hands. That there is something in my mind I want to say about this. Yes, Chef Ina.
Yes. I think I have summarized. And first of all, Dr. Renuka, wish you best of luck for your award. And secondly, thank you so much, Latifat, to give a brief about the sustainable and what should we do regarding the antimicrobial resistance. So I think so that awareness of sustainability is the issue is to understand the fragility of the environment and the importance of its protection, thinking in terms of an ecological consequences. If we talk about AMRI is a natural process that happened over the time through the genetic changes in the pathogens. It's emerged and spread in accelerated by the human activity, mainly the misuse and overuse of antimicrobial to treat, the prevent, on control the infection in human and animal and plants. So the antimicrobial resistance occurs when the germs like a bacteria, virus, or fungus that cause infection resist the effect of the medicines which we use to treat them. So these resistance bacteria can spread and may infect the people or animal. They are harder to treat than non-resistant bacteria. So all these type of microbes can develop the drug resistance. Thus, there are antibiotic or antifungal or antiviral and anti-parasitical resistance. So the issue is that what can, it's a question anybody can make a mind, that what can we do to prevent the antibiotic resistance? So I think so that don't take an antibiotic for our viruses. If we got virus, don't save an antibiotic for the next time you get the sick. Take antibiotic exactly as prescribed. Don't skip doses. If you take, so complete the course. Otherwise, the bacteria regenerate again. So never take an antibiotic prescribed for someone else. So if we talk about the environmental health, so I think so that environmental health is the branch of public health concerned with the all aspects of the natural and built environment affecting human health. So to effectively control the factors that may affect the health, to requirements that must be met to create a healthy environment must be determined. So the environmental health centers on the relationship between the people and their environment. When people are exposed to hazards like polluted air and lead in their drinking water, so they can develop serious conditions such as like asthma, heart diseases, cancer, or dementia. So if we talk about the environmental health, so clean air, stable climate, adequate water, sanitization and hygiene. It's the safe use of chemicals, protections from the radiations. So health and safe workplaces. So the sound of agriculture practices, health supportive cities, and the built environments, and preserve nature, all the prerequisites for good health. So I think so. How much we become a healthy life, human or a plant or environment. So we have to think about that, how we use these microbes. I think so. It's a summary of what Latifa said. So Latifa gave a brief account. So thank you, Latifa, to help.
Thank you for that very summary. Thank you so much. And are we all not guilty of the situation? When we visit our relative in the hospital, do we observe all what the professionals have said? Let's ask ourselves this very question. In our various homes, when things happen to us, what was the first step that we took? We all know. We all know. Are we all not guilty? Yes, Professor Femi Ajayi, you want to say some words to this very presentation? Yes, you have the floor now, sir. Then followed by Mr. Wanjusi after Professor Femi Ajayi.
Thank you so very much. Honestly, that is one of the things that I kept saying, that we need to make all these activities known to our people. It's obvious that there is no way we can achieve all of this or any of this if we don't have education. When we lack information, we act on our impulse. But when we have education, are you hearing me? Our world is launching into a bigger problem of what we do not see that will determine how we live. These microbes are not seen by naked eye, but they mostly determine how we live. Like Dr. Adebisi said, that are we not guilty? Who among us is not guilty? I started to be very careful after, I think there was a time I think my microbiologists will be able to tell us that wash your hand was the campaign. Anytime we go out, even touching the door of vehicles in town, touching naira note, touching any item at all, the onus is on us that when we get home, we do a thorough washing, sanitation, and as proclaimers of sustainability beyond words, I want to suggest, therefore, that as usual, this lecture has been recorded, will be made popular on our network. That's one. Number two, we should continue to promote education, community education. This is the little we can do in our own little way, and that is the only way we can be known. Because the microbial burden is becoming too much, going by the lecture that we received today. And there are various kinds. I think we need to handle everything as professionals. Thank you, our professional microbiologists. I really appreciate this presentation, and you can trust me. I will continue to insist on this within my own household and among my students anytime I have opportunity in the class. Thank you very much. I appreciate you.
Thank you, sir.
Thank you so much, Professor Ajayi. Before Mr. Wanjuzi will make his remark, I think there is something I want to ask the presenter of today, and that is how often do you discover how often do you receive query about microorganism in your lab? I don't know how to put the question. I want to know the frequency of the occurrence of this very risk of a microbial infection, microbial contamination, and how patients actually are actually victim. Yes, the rate of victim that people that you recorded in your lab. Can you give an experience of it?
Okay, thank you, sir. It's very often, it's very often, sir. Like for the last ones, we have various samples that we do receive. So for the general one, that are body fluid, we receive like total number of 269 samples, and above it, we have about 179 samples that resist to the antibiotics, amounting to about 68% of the whole samples. So you can see that it's very high. So the resistance strain, the antimicrobial resistance are those that resist at least one of the antibiotics at a go. But this one I recorded here, I'm saying now, they are like 5, they resist 5. You can now see if I now say I want to do the percentage of that's one antibiotic, it will be more. It will be that, okay, maybe all will be affected. So it's very often, sir.
I deliberately asked this question because that was how the conversation about the presentation actually started. That the rate of resistance in the laboratory testing is high. That is, if you have any invention that's related to microbial contamination today, there is a high chance that any prescription is not going to work for you. That is the meaning. That if they receive above 200 and close to 200 are resistant, that is the interpretation. That is, the number of the population of human beings that are resistant to any dosage of antimicrobial treatment is above average. That is a disaster. That is the interpretation, because at times when we narrate stories, and we don't interpret it in a way that we can easily understand, we may not get the message very right. If you and I, we fall victim of any microbial issue and we go to the hospital, they prescribe any drug for us, there is chance of a 99% that we may not get recovered based on that very prescription because of antimicrobial resistance. That is the meaning. Mr. Wanjuzi, you can have your contribution now. Is he here or he's not here again? Yes, while we are waiting for Mr. Wanjuzi to come back, I will come with a special question for Chef Zanir Hassan. But before that, I want to give the perspective of academia to Dr. Ebenezer Ajayi to say one or two things about this very serious issue. Dr. Ebenezer Ajayi.
Thank you very much, Dr. Adebisi, and a very good morning to all the participants. Well, I'm here in the morning, maybe good afternoon where you are. So it's a very issue of concern when we talk about antimicrobial resistance, and the speaker has really done justice to the topic. So we talk about lifestyle things. There is no way we can stay healthy for a long time. It's like a pendulum. So there will be a time of feeling healthy, there will be a time of feeling sick, and then we have to get back to becoming healthy. Sometimes we are able to bounce back with little or no external or exogenous support. And some other times we need some help to overcome whatever assault that our body is suffering. So sometimes the drugs that we take, there is one school of thought that talks about omets, that they are not maybe drugs in themselves, but they are something that can help the cells. They challenge the cells so that the cells can produce metabolites that can now make it bounce back. So it's not every time that we need to pop the pill and swallow some drugs. It's a One Health approach. One Health approach in the sense that we find people who do indiscriminate application of antibiotics, even in plants. People apply antibiotics in plants, and they give seminars to teach people how to apply antibiotics to their plants so that they can overcome certain infections and pests and co. Then poultry keepers, people keep ruminants, they also put antibiotics indiscriminately. And we keep saying that we end up feeding on these things, and then they increase the antimicrobial burden in our bodies. So many times we eat food, we don't know what they have put there. They use some antibiotics to cook meat, or probably even the acetaminophen, paracetamol to soften or tenderize meat. And that's the same meat we eat when we go out to some restaurant or food center, and we do not know. And then all these things will come back in the long run to tell on our kidneys and other things. No, we cannot forget food interaction and food-drug interaction. So when people are now applying drugs to tenderize meat or to kill some meat, and some will say because it was a dead meat or the poultry was sick, and then we sell out the poultry at a cheaper rate. And someone will buy it and say, yes, I know the chicken is sick. I will kill it and then boil it with tetracycline, and then I will sell it off. So we don't know the person who is coming into it. You don't know what condition they have in their bodies. We don't know what drugs they are already taking in their bodies. And then when all these things collide, it causes problem. At the risk of sounding controversial, permit me to mention this disturbing thing. Disturbing maybe among young people or young adults, or sometimes among even adults, so-called adults. It's about sex. Many people are not playing safe sex, despite the fact that, yes, we cannot preach to everyone to abstain. While some people think in their minds or in their heads that they are playing safe sex. You see people talking about, well, I want to satisfy the other partner they just met online, or they just met somewhere, somehow. And then they say, yes, we are using condom, I think I am safe. But they go ahead to do some other sexual practices that what do I call it now? That throws away the caution. So beyond wearing condoms, you think you have protected yourself, but you are playing oral sex. So who are you fooling? So people will think that I will just go over the counter and buy antimicrobials or some antiviral drugs, or they told me if I use this lime or use this plant product, I will not be exposed to infection. But they are fooling themselves. And like Professor Ajayi said, we need to keep educating people. You should be safe out there with your water, with your food, and with your sexual life. So, and the best way to keep away from infection is abstinence. But they say if you cannot abstain, make sure you do safely. But people think that once they buy a condom of 200 naira or whatever amount, $1 condom, whatever amount it is, they are safe. But in there, they still put their mouth in their mouth. They put their hand in their mouth. And you think you are playing safe. HPV, for example, will be transferred from saliva to saliva. And you are doing long kissing, you are doing all of this. So the best way to be safe than sorry is to keep yourself and keep probably to your partner. So jumping from one partner to the other, you will never know their history. You are exposing yourself to a lot of risk. You may be very, very meticulous and clean in your house environment, in your kitchen, in your toilet, everywhere. But in this other area, you may not be clean. And at the end of the day, you'll be wondering, in my culture, as Yoruba people, we call something arungbajumo. That's disease of affluence. Now, I've talked about disease of poverty before. Now I know that Yoruba people know in my culture that there are diseases of affluence. You see rich people who have syphilis, you see people who have herpes, you have rich people who have this and that, HPV, and you say, yes, he has money, so he can carry lots of women. Or that woman is very well established. She's a businessman woman, and that's why she can afford to have different men. Okay. Now the diseases that come with it. When I was in Argentina and we're trying to do some language training, we have some clubs we go where we do English for 1 hour and then Spanish for another hour. It was fun. Then thereafter, they will say whoever wants to stay behind, it leads to a kind of club and they stay till you want. Then among those people, I begin to see people with warts on their lip, around the mouth. And I will ask them, are you sick? You know, in Yoruba, we say ishinu, this kind of symptom around the mouth when you have malaria. But as a biochemist, I know it can be more than that. It's not a symptom for malaria. And the symptom in malaria does not happen to everybody. For instance, I don't have that around my mouth when I have malaria. But I know it's a symptom for something else, a sexually transmitted disease. And among these guys and girls, there are people who go about kissing everyone from every nationality in the name of, I'm getting to know more people.
Yeah.
So you are studying hard as a student, you are taking a master's degree, you are taking a PhD degree, and you are mingling with people, but you are not keeping everything safe. You will be very neat, you will be very meticulous, like I said. Another practice they do in Argentina is a sharing of a cultural drink called mate. This mate culture is that you sip from the straw, called the cup mate, and the straw bombilla. You sip from that straw. It's some herbal thing. I've forgotten the botanical name of that plant. You distill it usually with hot water. It is terere if you put cold water and ice during the summer. So you now pass it to the next person. Either you know the person or you don't know the person. The other person, when the water is done, you carry flask and then you put hot water again and pass to another person. So from my background, I know sharing cups with strangers may be a dangerous thing. But if you don't accept it, it seems as if you are not accepting them. So reluctantly, I would. But later on, I began to make boundaries to say, the person I do not really know, I don't want to share with the person. And I think if it goes to the extent of keeping my own bombilla, my straw in my pocket, I wouldn't mind. You know, so there are some practices that are cultural that people don't want to stop, but we already know that they expose us to infection. So we have to balance all these things. We cannot be perfect in all of these things, but as far as it depends on you, do it within your family. Teach it to your children. Teach it to your family members. And globally too, when there are pandemic, you know, it becomes something very necessary to tell people to desist from doing and practicing. And lastly, for every solution we prefer, we create another problem. So that's the beauty. It's a continuous thing. So long we are breathing and we have blood running through our veins, we are responsible to lead a healthy life and to help others to lead the same. Because if the problem comes, all of us, we have to abandon whatever we are doing to look after the other person. The same way we can have herd immunity, the same way we can have someone that can infect the whole community. Thank you for this privilege and good morning.
Wow, that's another dimension. And it has opened up another conversation on its own. So the question I want to ask, yes, Mr. Wanjusi, are you here now? Yes, Mr. Wanjusi, before I go to Chef Zanib Hassan. Mr. Wanjusi.
Thank you very much, Dr. Said. And thank you for this sustainability topic concerning health, which is very important because health is wealth. And if we don't look after our health, it is the only, to be productive, you have to be healthy. And most of these topics we are discussing, I have happened to have worked in, the other time we were discussing about food sustainability. And like I mentioned, I've worked in the food industry before. And I've also worked in hospitals. When I was in the UK, I worked in the hospital. I was a healthcare assistant. And I've been through most of these areas we are discussing. And I wish I had these ideas I'm getting now. When I was in those fields, I would be, somewhere else. But still, we need to learn. Every day is a learning process. Now, the speaker, that was Letitia, the presenter, talked about, she mentioned something about waste. And in my country here in Uganda, this waste that comes from the hospital, these needles and they are not disposing them well. And I wish she could say or provide a method how we could dispose of those hospital wastes. Because if they keep on throwing them anywhere, the environment also gets affected, and the population of the people staying around there, when they go picking these needles and that waste, it brings in more sicknesses. So that area needs to be worked on. And what else did I want to say? Yes, it is very important, and I'm going to share whatever I've learned here with my community, so that what is being said here is put on the ground, and we practice these sustainability methods to improve on our lives and also preserve the environment. So briefly, that's what I wanted to say. Thank you very much.
Thank you so much, Mr. Wanjusi. I think Mr. Wanjusi is currently becoming the secretary of the GSLSN in Africa. Are you going to take it?
Dr. Said, if I get the honor from you, it's my pleasure.
Thank you so much. Because you have never missed any session like Professor Ajayi. Thank you so much. Yes, sir. The question I want to ask with a testimony. I used to have a cold and cough, like my usual ailments. Whenever there is a rain and a transition between the rain season and the dry season, I used to have cold and cough. And then occasionally I used to have malaria. Then I try to estimate the last time that I actually treated malaria, and it is over 15 years now. And what happened then was that I discovered a particular tree that I am familiar with. I researched into it and I've been using that very herb since then. And what the herb does is that whenever you have malaria, or before you have malaria, or you are prone to malaria, if you are taking that very leaf tea occasionally, it's going to break the cycle of the malaria. So I will have the feelings that I am going to have malaria, or I have a kind of a likelihood of having malaria, but it will just disappear because the cycle of that very parasite will be broken and it will not be able to transfer into the seriousness of the malaria. That has been the practice for over 15 years. The second thing I want to make testimony about is that I got a cough, a very serious cough, dry cough. I think sometime in 2014 or so. I used like 3 different cough syrups and cough tablets. It didn't go. And I was even having a serious one that drained my strength and tried to even suck my blood, that I was feeling dizzy. And I was like, no, this is not the usual drug that I used to take. Not knowing that they have mixed it with, I think, antimicrobial something. So I didn't know that it used to drain blood. So after that, I consulted. I consulted with this very presenter who presented today, and I discussed the issue that I am having a serious infection of a cough, but I didn't know what is happening. And when I explained everything, and they prescribed something to me that I should try to take honey and onion. And since that very time, since that very year, I didn't have cold, I didn't have cough. Because that is what I use always: onion, honey, and ginger. Even I make it into teas, and I am free of. I prescribe it to many of my students and many of my neighbors. You don't need to waste time to waste money on buying drugs and something like that. There are some food materials, food recipes, and also our local available materials around others you can use to actually make yourself immune to all these things. And when you practice a very high level of hygiene, you wash your hands, you take care of your environment, you clean your waste very effectively, you can save yourself of this very cost of wasting money on the hospital bills, and also buying drugs, and also doing a lot of things that is going to expose your most of your organs of the system into a lot of danger. I just give that very kind of a testimony to say that our food is also very, very important. Our choice of recipe is also very, very important. And the last thing I want to say before I will ask the question from Chef Zanib Hassan concerning this is that I learned from the culinary training education that if your food is cold, it is not advisable for you to eat it, because definitely you have some microbes that are already colonizing that very food. And they may not be able to propagate very enough to actually cause you harm, but they are already colonizing that food. It is better for you to take your food when it is at the temperature of between 50 and 60. And when you have left it a long time, that it is better you raise the temperature to 75 to 100 before you take the food again. And what is your experience concerning this very food coldness, food warmness, food hotness, when we are talking about the microbes and the health of the human being? Chef Zanibasa.
Please talk. When I serve food, I prefer my food, it should be very fresh. I should not use things directly from the freezer or fridge. I use fresh things, right? I prefer not to heat them in the microwave. I directly cook them and serve them right on the spot. I really like that I use fresh meat, not the frozen one, not the frozen foods or anything like I don't want to reuse the sauces. Even the sauces, I prefer them to make them absolutely fresh when I have to serve them. So I don't use preserved things. I think that's a healthy thing for everybody to follow, that you should not use the things reheated, or microwaves should be used very less. And I think I prefer making sauces and everything at home. I cook everything in a manner that I should not preserve them for the next use. I should make everything fresh on the table, and I think that's a healthy thing for everybody to follow. And where these antibiotics are being discussed, I think you should first try the home remedies. As you were saying, you took ginger and onion for a bad cough. I think home remedies should be ready initially. Try them first, then go to the antibiotics. I don't think you should take very strong antibiotics on the spot. You have started cough, you should take some home remedies first. They are much better. And
Wow. Thank you. Thank you so very much. And I think some people are feeling guilty. Like, I used to preserve my food for a week, for a month. In fact, some people will buy a month food. They will buy a month food that they will be taking. Yes, Dr. Mary Gicho. Yes, you are a veterinarian. I have read it in the comment, and with your expertise, I think there is a big issue around the dairy, especially around the animals. Please, can you share your experience, please, Dr. Mary Gicho?
Yes, thank you. Thank you so much for this topic. It's very relevant to me. And when we talk about AMR, I think we as veterinarians are right there in the mix, because we are the ones who sometimes do not exercise prudent drug use. So most of the time when the farmer calls, you will quickly opt for an antibiotic that you know is safe for the animal, and this is a producing animal. And then the farmer will not observe the withdrawal periods, so that the food products from animal origin get into the value chain, whether it's egg value chain, milk, meat. So I think veterinarians are right there. So if an animal is on treatment, most farmers will prefer to sell it. The sad thing is that when you sell this animal, at the point of market, there is no test, a platform test that detects that this egg or meat or milk has antibiotics. So all of these food products will get into the food chain. So I think it's with the issue of AMR, we cannot escape the constant collaboration and communication and the self-responsibility and ethics when it comes to practice. But I like the idea of heating food. I did not realize that. For me, I have not cared whether I'm eating cold or warm food, but now I know I should eat warm food. So such platforms are good to learn something new. Even the issue of onion. For us, we are used to taking garlic and honey and ginger instead of onion. I did not know onion is also a good alternative. Yes, so we are there. And sadly, I am throwing stones at myself and my fellow colleagues, but it is true. We are there. Thank you very much.
Yeah, thank you. Thank you so very much. And I want us to also research more about the garlic. I think onion is safer than the garlic. The garlic has some chronic consequences at the high dosage and also on the prolonged use. Let us check for the garlic implications very well. I think I dictated that when I had one case when I was in Germany, and I was trying to use garlic, and I was feeling somehow heat within me. I think there were a lot of things I learned from the culinary education or something. There is a sensation they call heat, they call warm food, they call warm flavor, they call warm seasoning. A lot of things, very interesting things. So there is a kind of a sensation of heat when we take some of these very something. Let's check. Yes, chef.
More than 2 hours. So I heard about that. So the hot food should be keep in the internal temperature of 140°F or warmer. So use a food thermometer for checking the temperature of any food. So serve to keep the food hot in the chefing dish when we are dishing the food or serve the food. So slow cookers and warming trays when we use in the hotels or anywhere we are using them. So we have to be concentrate on the temperature. It is very a big issue. Yani if we cannot think about that, so I think the aim of the internal temperature, yani approximately 75°C or hotter than. So when you cook food, so heating foods to this temperature kill most food poisoning bacteria. So use a thermometer to check the internal temperature of any food if you are cooking in your kitchen. So I think so we are talking about the micro bacteria or these things because we cannot see in our naked eye. So we have to take precaution in our kitchen. Mostly we women, we are doing work in the homes. So this is my thinking about the hot or cold serving things. Yes, doctor.
Thank you. Thank you so much. And yes, about the kitchen practices, whenever you use any utensils in the kitchen, wash it.
Yes, must be.
And the best washing advice is to wash it with the
warm or hot water.
Yes, with the warm water
Yeah.
and soap. And also what you need to sanitize always. Because most of these things are little things that we don't pay attention to. Yes, we have a member joining us before we come to Dr. Ebenezer. I saw him raising his hand. Mr. Moses Olojede, please, can you talk to us? Mr. Moses Olojede and Mrs. Adejoke. I think we have the new members joining us on this session today. Please, can you talk to us? Mr. Moses Olojede and Mrs. Adejoke. Open your mic and talk to us about this very topic. Mr. Moses Olojede, are you there? Then Mrs. Adejoke, are you there? So while waiting for them, I think we have another person that came in just briefly. Okay, he or she has disconnected. Okay, let's take the remark of Dr. Ebenezer. Is he here again? Is Dr. Ebenezer here? Okay.
Okay, thank you.
Yes.
I just quickly want to add a little piece when you were discussing about your application of herbal supplement or something. As much as it is okay to use herbal supplement, we should not totally jettison approaching the hospital for medication. Usually, even with medications, there is this usual balance that if the condition does not improve after 3 days, see your doctor. So we don't just keep struggling to say, I want to keep using this. During when NYC, the National Youth Service COP scheme, I work with the Molecular Biosciences Limited, where we are doing tissue culture for plants. And we were growing Artemisia, the plant where we have the extract for artesunate at that time. So most farm hands, they felt it would be cheaper instead of using their Miaga salary to go buy anti-malaria drugs. They would just take the leaf or the whole plant of Artemisia and then extract and drink. So it has chemosuppression potential. And at the end of the day, they will still go to the hospital. You know, they don't know how much to drink. They will not know how to do the dosage, such as it were. And sometimes they will combine it with several other plants. In the long run, we may find out that they will do chemosuppression. Maybe from time to time, if you drink it, it can keep us away from having malaria, for example, but it does not really, finally, it may not necessarily do the parasite clearance from our blood. So we should check from time to time. And it's good. Curative, those ones that have been established to have curative potential among those plant or vegetal plant parts, we can do them. But maybe not necessarily to replace medications. But if you find them and you know how to apply them, then go ahead and use them. There are people who are custodian of this knowledge, this traditional knowledge. If you have them handy and you can follow the advice, it is okay. But don't go too far if you don't find improvement, because the hospital may now reject and say, it has been, you should have reported since. How many months have you been treating yourself? 3 months. Who treats malaria for 3 months? So on the third day, you should go and show yourself to the expert. So thank you very much.
Thank you so much. You know, he is a biochemist, so he understood what you can see. There is a way that we should be giving information, and with what Dr. Ebenezer has said, I want to confess something. If you see the way I treated the case of malaria, I didn't mention the plant. It was deliberate. I didn't mention the plant. But when I know that there is a one that it has no side effect and people can actually get used to it as a recipe of the food, which is the ginger, the onion. But that of the plant of the malaria, I didn't mention it because it has so many side effects. And before I get acquainted into it, I made research, peer review paper on it, so that I understood how that very plant was actually working. Because I was like, I'm not actually having malaria, but I want to understand why is it that I am using this plant and I am not having malaria? What is it doing within my body system? So that was the investigation that I did. But I know an ordinary person may not go to that extent and just be consuming that very. I know it has different ways of how people are using it, but to understand how safe or the safe use of it, it is very, very complicated. And that's the reason why deliberately I didn't mention that very plant. And like us also, we should be very smart in the way we dish information to the people, especially when we are professionals, so that we don't endanger their life while we are trying to educate them, so that we know the questions for them to ask at the right appropriate quarters. They should visit the hospital, they should visit the laboratory, they should visit the chemist or something. So if we know that what we want to tell them, they may not understand it to that level that we are all trained. I think that is a very smart one from Dr. Ebenezer. You caught me. Well, that was the formula that I used. Yes, that was the formula that I used. Yes, I think we have had a very important discussion today, and it has been very fruitful and very revealing. And also, we are going to continue this very discussion next week at the same time. We are going to open up on different chapters of this very the health sustainability triangle, the environment, the human, and the microbes. We just opened up the discussion today. We are going to continue digging into different aspects as we are moving into the core discussion at this very month. And at the end of the day, we will find a niche that we are going to create our proposal and also submit it for a grant. And that is what we want to do all through this very month. And I want to welcome everybody and appreciate everybody that has participated. And I want to call upon Mr. Bayo Adeyemo to thank all our guests and also all our participants at the session today. Mr. Bayo Adeyemo.
All right. We appreciate every participant at this session today. We pray Almighty God to be with every one of us. We continue to be living in good health and sound mind. Amen. So thank you, the facilitator, the coordinator, and everybody here present for this Saturday's season of our program. So till we meet next week. Thank you and God bless you all.
So thank you so much. Chair Zanib Hassan, thank you so much for joining us. Dr. Ebenezer, thank you so much. Mr. Ili Mumbaga. Mr. Mumbaga, we are going to take you fresh comment from you next week by God's grace. We thank you so sincerely, all the way from I think Kenya. Yeah, all the way from Kenya, and also Dr. Mary Gicho, thank you so much. Yeah, Professor Femi Ajayi, thank you so much. Yeah. Mrs. Adejoke, thank you so much. Mr. Olejedu, thank you so much. Mr. Christian, thank you so much. Mr. Alimi Mohammed Olagoke, thank you so much. So till we meet next week, I say goodbye and have a very lovely weekend. Bye-bye for now.
Bye-bye.
Bye. Bye. Thank you.
Bye, everyone.
And to our lecturer, thank you so much. Thank you so much.
Thank you, sir.
Thank you, our lecturer.